fat burners, take X fatty acid or eat more fat to burn more fat. Why are people mistaken there? And something you said just now, I guess we can dive into it. It's a fun one. Fat burners, take X fatty acid or eat more fat to burn more fat. Why are people mistaken there? Because if you eat more fat, aren't you going to be oxidizing more fatty acids? You're burning more fat, Kyle.
Yeah, so there's a difference between, this term fat burners is really misleading because there are things that you can take, whether it's a supplement or a medication or food, that help you consume less calories. And that is how you're going to lose weight. There's also things that have a lipolysis benefit, so that help you break up fatty acids and utilize those fatty acids in your adipose tissue. And occasionally these things will also convert white fat to more metabolically active beige fat, so you have more beta oxidation. So some of these supplements do have a lipolysis benefit. Growth hormone's actually similar in GHRPs, but that doesn't mean that they're helpful for weight loss. So it is misleading and also just wrong that they're marketed for weight loss.
Yeah, and I see these ads all the time. Like you mentioned specifically CLA, it's marketed as a fat burner. You have companies selling it as a fat burner. Maybe these people are going to be oxidizing more fat, but the outcome that they're interested in is losing body fat over a period of time. And unless the calorie situation changes, then you're likely not going to see that outcome. Mm-hmm. Or people can have some recomposition in the right circumstances if they're resistance training, have their protein intake where it needs to be, and so forth. And that lipolysis is really interesting. I think that is part of the reason that the growth hormone is such a potent inducer of lipolysis, and I think that's part of why it induces the insulin resistance, in addition to increasing insulin secretion. And I remember this back in the hospital when you had people on TPN, and they're getting free fatty acids just right into the bloodstream, and it induces profound insulin resistance. And you're seeing that to a lesser effect. I don't think anybody's running a glucose of 500 because of growth hormone at appropriate doses, but you do see some people who are particularly susceptible to getting some insulin resistance from growth hormone.
Yep. Fatty acids are generally broken down in a process known as beta oxidation, just to produce ATP, similar to how glucose produces ATP as well. And a good rule of thumb is the more fat that is in your diet, the more beta oxidation you want to happen. However, if there's more fat in the diet, especially if they're in general relatively healthy fats from whole foods, that same fat that you're consuming will help you do beta oxidation more. So many fats do this, not just CLA, but also TTA. There's a system called PPAR, which is in your mitochondria. And the PPAR is activated by many things. Fatty acids like TTA often activate them. And if it activates one PPAR, three of the major ones are alpha, gamma, and delta. There's also medications that activate these, for example, fibrates, or even TZDs, or cardarine, which was studied and did not pass clinical trials. But anyway, if that is the rate-limiting step, then it could be potentially beneficial to incorporate fats into your diet or supplements to help prevent things like fatty liver disease.
Yeah, and the TTA is really interesting because at one time it looks like it was being developed as a drug target, as a PPAR alpha agonist. PPAR delta agonism, I think, is where the kind of cancer risk comes from. And anytime you have a strong agonist of that, like the cardarine or even the TZDs, there's a little bit of a cancer risk there. But with the TTA, there was one clinical study, I think this was about a decade ago, and they saw that it did improve lipid profiles and I believe insulin resistance a little bit in a diabetic population. Mm-hmm. So I think that was around a gram per day, which is not a significant amount. A lot of people take several grams of omega-3 fatty acids per day, but it seems like it was kind of cut off in the pipeline. I don't think it made it past phase 2.
Mm-hmm. Yeah, it'd be interesting to see if it had any effect on like neoplastic risk at very high doses. Probably not. And it is the population that would potentially benefit would be, one, people who are on very high fat diets like the carnivore diet, early on in the diet, it's much easier to prevent things like fatty liver disease than to treat them. And then also people who are on high doses of L-carnitine, because it helps the body use L-carnitine kind of synergistically in order to have more beta oxidation. So potentially people who are injecting L-carnitine, which we've talked about recently.
Yeah, and some of the studies in preclinical literature looking at TTA, I believe you mentioned, it's almost like it appears to be a shuttling effect where you use something like TTA and you see more carnitine or carnitine precursors going into the cell, presumably because there's a little bit of a limitation in the literature here, and then other fatty acids potentially being shuttled into the cell as well. In that clinical trial, they actually measured the omega-3 fatty acids in the blood, and they saw 10 to 15% decreases in those. And is that because people are not absorbing them, or because they're going into the cells, or is it just an artifact because it's just one study? We really don't know, but it's interesting, and it kind of lines up with some of that preclinical mechanism. Just like the obese rats that are fed TTA, it is very protective for their liver. Not everything translates from the mouse studies, but there are specific populations you could say, based on what we know about the way this works and the mechanism, it would stand to benefit these people more.
Mm-hmm. Yeah, absolutely. That's kind of the premise of individualized medicine, I suppose. Another thing on that note is that is another reason why we like to check intracellular red blood cell or white blood cell omega-3s. Otherwise, you can have a salmon the previous night and your serum omega-3s will significantly change. So that's something to think about. Just like if you're worried about insulin resistance or diabetes, you should take an A1C and not just a fasting glucose.